Sneezing, wheezing, itchy eyes, runny nose. Allergy season is upon us. It's a rough time for the 20 to 25% of Canadians affected by seasonal allergies. The good news, there are a lot of quick, easy strategies to help manage symptoms. Pharmacist Victor Wong joins us via Skype from Toronto. Hello, Victor.
Hi, how are you?
I'm good, thanks. When exactly is allergy season?
So there's 3 distinct allergy seasons here in Canada. There's the spring allergy season, which is really the pollen from the trees. So springtime, the trees are growing, it's starting to bud. And then as it moves to summer, there is a lot of grass pollen. So people who are allergic to grass, they have the symptoms then. And then towards the fall, we have a lot of mold from rotting vegetation and plants, as well as ragweed as well.
And what's the difference between indoor and outdoor allergies? What are the triggers?
Right, so indoor allergies are triggers like dust mites, and sometimes we have some insects and molds. And these things last all year round, all the way from springtime through to winter as well, because it grows indoors. Whereas outdoor triggers are really from plants that are found outdoors. And usually by the time winter rolls around, those symptoms will go away.
All right, how do you identify allergy symptoms?
Yeah, so the symptoms between allergies and colds are often very similar. So with both of them, there's sneezing and runny nose and congestion. And sometimes things like cough and sore throat, often people think of them with colds, but allergy sufferers can also sometimes get these symptoms. But there are some key tips that I want to tell the viewers about that can really help distinguish them. So first one is muscle aches and fevers. Allergies do not include those, only colds and flus. So that's a big sign. Second thing is the time of the year. So with allergies, seasonal allergies, oftentimes they happen, as we mentioned, from spring to fall. With colds, they usually happen during the winter months. And also take a look at how long these symptoms last. So with colds, they only last for about 3 to 14 days, whereas with allergies, they can last for multiple weeks. So that's a huge sign. And the last thing is genetics. So oftentimes, if there's one parent who has allergies, the child will have a 1 in 3 chance of also developing allergies. And if both parents have this type of allergy, oftentimes there's a 7 in 10 chance that the child will also have seasonal allergies as well.
Okay, what are some ways, Victor, we can manage symptoms?
Yeah, so there's different types of treatments. First of all, the most common one are allergy tablets. There's newer ones like Reactin, Arius, and Claritin. And these are once a day, and they're not on track. But there are also some older ones like Benadryl. They're taken more frequently, but they work very well, but they do cause some drowsiness. And there's really no way of saying which one is better for a person. All the studies show that they're all equally as good. It's really individual. So you have to try out a few types before you find one that works for you. And when you find it, it's best to stick with it. There's also nose sprays that help with any stuffy nose. These are great for just those localized symptoms. And lastly, there are some eye drops, and these can be used for immediate treatment of any itchy eyes and runny nose. Itchy eyes. But they can also be used preventatively. So if you use the allergy medications ahead of time, at least 1 or 2 days before, they can actually help the symptoms from even occurring in the first place.
Thanks for the information and for your time today, Victor.
You're very welcome.